Good.
So in this segment, we're going to be reviewing the use of the scanners, the matrix. Sorry again.
Go ahead.
Sorry. No, that's it. Okay. So in this segment, we're going to be reviewing the bioelectric scan using the MatrixMag scanners. And so first of all, we want to consider how these scanners are constructed. These are very highly powered, concentric, alternating polarity magnets, and there's a large one and a small one. The label side is the stronger setting for either one, the larger being a stronger magnetic configuration than the small one, and that is with the labels towards the body. The non-label side towards the body is the weaker, slightly weaker configuration. The most common setting will be with the label side of the small one towards the body, or the weaker side, the non-label side of the larger one. That represents approximately 90% of the people you will be assessing or treating. All right? So, in order to start your bioelectric scan, you want to choose an indicator site. And the indicator site used most often is in the lower rib cage. And in order to determine which side of the rib cage would be optimal, is test the resistance or compliance of the rib cage on both sides and see which is the most compliant, which means the less primary side as your starting point, if possible. It's still okay to use the more resistant side if there's no other option. Other options include the quadriceps muscle, which is relatively centrally located, and another option would be the extensor muscles in the forearm. Okay? In each case, when you're approaching the indicator site, try to allow the barrier to fill your hand. And what you want to guard against is any excessive motion of the hand, like so, or gliding on the tissue, or using the heel of the hand. All of these will give you a false reading in terms of the depth of the barrier, which is really what you're looking for. In addition to that, avoid a pumping action of the arm or excessive body motion. Just try to ease into it, allow the barrier to fill your hand. You should also be aware when you connect to that depth, you're feeling that piezoelectric flow going through your body, and it should be very comfortable for the patient as well. So have a look at their face, make sure they're not straining or grimacing, because that may indicate there's a sore area there, in which case you might need to move to a different indicator site. So once you've tested each of the scanners, so you test those first of all by placing them on the trunk of the body and giving a little bit of a time delay. Every time you place the scanner, wait for at least 1 or 2 seconds before you test the depth of the indicator. All right? So testing one side, turning it over, waiting a couple of seconds as you rest your hand in between, and again testing the barrier depth, like so. Test each of the scanners if none shows up, and just compare each one, remembering to give it a little bit of time delay between placing the scanner and testing the depth of the indicator site, the barrier. Good. So once you've determined which scanner configuration is optimal, in this case the smaller one with the label side facing towards the body, again a common configuration will show up. In some cases you can use for other types of testing, for testing the effects of different primaries, you can use the stronger side of the smaller scanner in tandem with the weaker side of the larger one, because those two settings are close to each other in terms of their strength of signal. All right? So that's a common configuration, either one of those. If the weaker side of the small one shows up as the choice in that situation, you might want to consider that this individual has a slightly higher magnetic sensitivity, which may make them more vulnerable to things like Wi-Fi signals, cell phone signals, microwaves, and so on. And If the stronger side of the larger one towards the body shows up, that may indicate a state of relative biochemical imbalance, which may include toxicity, dehydration, or presence of certain chemicals like prescription drugs, which are interfering with the transmittance or response of tissue. Right? In many cases, it's a simple case of dehydration, which is quite common, which can be corrected by asking the patient to take a good drink of water, and then within a few minutes you should actually see an improvement or a more normal setting for the scanners. Okay, so once you've determined which scanner to use, have the patient bend their knee. We're going to start with just this side here so you can see where I'm going. And we're going to start with the scanner away from the body, make sure the patient's hands are off the body and at their sides with the palm facing down because the hand will affect their field. So then we test the barrier in neutral with no influence from the scanner. Keep it at least 6 to 12 inches away from the body before you start your test. Make sure that things like underwire bras, metal watch bands, cell phones, everything else like that is accounted for because they can interfere with the response. As well, you should guard against using those or having those on your person when you're testing. Make sure you're in a comfortable, balanced position when you're testing the barrier so you can get good feedback, feel that connection in your body when you attain the barrier. All right? And once you feel the barrier neutral, just relax that hand on the indicator site. Okay? And then take your scanner and place it on a target area. And in each case, as you go from position to position, wait a couple of seconds before testing barrier. So even though I'm reaching down towards the foot, if you notice my arm is still in a relative position perpendicular to the rib cage here, so it's consistent. All right? I could use the rib cage, I could be using the muscles in the forearm. In each case, you want to make sure that the hand is very quiet, comfortable, letting the barrier fill your hand, feel that connection each time. Okay? So you can place the scanner, wait a couple of seconds and test, relax your indicator hand, move it to the next site, which might be here in the mid-tibial shaft, wait a couple of seconds, and here you're not putting any pressure on these areas, you're just literally laying it on the area, going close to the area to influence that tissue. Wait for at least 1 or 2 seconds, and then test your indicator site. In some cases where there is some biochemical imbalance, there may be something called a delayed response, in which case your interval between placing the scanner and testing the indicator may be longer. So in some cases, if nothing is showing up, test that possibility. That delayed response may be associated with chemical or biochemical imbalance, okay, and then that may take longer. As you proceed with that individual continuing to test, that interval may diminish, okay, and come back to a closer level because this has a therapeutic effect which mobilizes their electromagnetic function, and therefore the interval, the delayed response may be relatively improved. Okay. All right, so you're continuing your scan all the way up the body. You're starting with the lower quadrant coming up. Your position is across from the pelvis. Then to do the upper quadrant, you're going to position yourself with a new position on the rib cage, if that's what you're using. In the case of the rib cage, though, because of the natural angulation outward towards the inferior, you need to apply a slightly pronated position of the hand to stay relative to the rib angles here. Otherwise, the hand will tend to glide down over the costal margin, which is not very useful in terms of getting a consistent feedback from the body. So maintain a slight pronation in this position. Don't lock the arm, keep it, it'll comfortably flexed, but keep it steady. No pumping, just go in, get your baseline, relax the hand, continue your scan on each of the areas up through the trunk, rib cage, looking at the neck and shoulders, turning your head slightly away. So on the neck, coming up through the articular processes, up through the cranial base, facial areas, cranium, and so on, and then turning the head the other way to get the opposite side of the neck and the other side of the facial area, occipital, parietal, sphenoid, and so on. And then anteriorly through the frontal area, the orbital area, nasal, and anterior oral area as well to complete your scan. Now, one other consideration when you're scanning is that the penetration of each of these scanners is roughly, we'll say, 2 to 3 centimeters in depth. The larger one is slightly more. However, if you're looking at determining, let's say in the trunk, because there are various tissues layered one on top of the other, in order for you to determine, let's say, in the next step, what is it that's influencing you? Because in this area, for example, in the upper abdomen, a positive finding may indicate stomach, liver, and so on. However, the thoracolumbar spine is also present at a deeper level in this area. So one way to differentiate that, get you to put your leg down, is to actually test it with your regular setting, okay? But then also take a stronger setting with the other scanner and see if that actually gives you more of a response. That may indicate a deeper structure, in this case being the spine relative to the abdominal visceral contents. The same can be used for the pelvic area to differentiate that from the sacrum. Right? And also that can be useful when you're treating, when you're placing the scanner in relation to the area you're treating. Think about the depth of the structure that you're looking at or focusing on, and perhaps go one step up on the scanner response. For example, if the strongest signal was showing up on your superficial readings, which is not very common, to go deeper you could boost the signal by stacking the smaller one right over it. And that will give you another layer of influence, magnetic influence, which will go into the more posterior structures of this position as well.